We just received breaking news that a 65-year-old man has escaped from Sunny Valley Retirement Home in Oshawa. Security cameras caught the footage on tape of him leaving the building on Friday afternoon.
Hi, this is Nathan here. I'm standing outside the scene at the University of Ontario Institute of Technology where just moments ago a man suffering from Alzheimer's was seen aimlessly wandering around. The family just asked that the public keeps an eye out so that he can be returned safely to his family. The police have been notified as the man who suffers Alzheimer's disease needs medication. Thank you.
Wow, what a terrible turn of events, Christine.
Well, this isn't the first time this has happened. For those of you that are not aware, Alzheimer's disease is a progressive degenerative disorder of the brain that attacks nerve cells or neurons, resulting in loss of memory, thinking, language skills, and behavioral changes. It is the most common form of dementia among people aged 65 years and older. Let's see what Dr. McNeely has to say.
Hi, I'm Dr. Peter McNeely. Today I'm here to talk to you a bit about the two types of abnormal lesions that clog the brain in individuals with Alzheimer's. The first is the beta amyloid plaques. These are sticky clumps of protein fragments and cellular material that form outside and around neurons. The second type of abnormal lesion is a neurofibrillary tangles. These are insoluble twisted fibers composed largely of protein that builds inside the nerve cells. Back to the newsroom.
As we were talking earlier, Alzheimer's disease is not all that uncommon. Today, 500,000 Canadians have Alzheimer's disease or a related dementia. Approximately 71,000 of them are under the age of 65. This means that 1 in 11 Canadians over the age of 65 currently have an Alzheimer's disease or related dementia.
Wow, isn't that astonishing?
It is, Christine. Now let's take it to Dr. Hodgson to tell us more about the signs and symptoms to look for if you suspect that your family member has Alzheimer's.
Greetings. As you can see, my patient here, Mrs. Harlow, displays the following signs and symptoms of Alzheimer's disease. The first is memory loss that affects daily life, including frequent forgetfulness of recently learned information, important dates, events, and repeatedly asking similar questions and relying on memory aids or other people for things normally accomplished on their own. Isn't that right, Mrs. Harlow?
Yes, that's right, dear.
The patient also experiences difficulty completing familiar tasks, such as daily tasks, whether at home, work, or leisure, including, but not limited to, driving to a common destination or getting ready in the morning. Confusion with time or place often occurs as the individual easily loses track of time, dates, or even seasons as they pass. They may forget where they are and how they got there. The patient often misplaces or puts things in unusual places and is unable to retrace their steps, or may simply forget the normal location where an item may be found. Decreased judgment may be displayed, causing poor decision making when dealing with everyday situations, such as spending money or altered grooming habits. The patient may begin to opt out of activities and become socially isolated from hobbies, social, and work activities. Altered mood and personality may be shown, and frequent changes in mood, feeling, or acting out of character when placed outside of their comfort zone. Now we're returning to Dr. McNeely to discuss some risk factors.
Where are we going again?
So in addition to many signs and symptoms, there are also many factors that predispose an individual to develop Alzheimer's disease. It is important to know that there is not one specific risk factor, but rather a combined effect of many risk factors. I'm going to go over a few in detail and then list some other ones. So the main one is age. As we age, our ability to repair damage to the brain is reduced. The ability to repair the brain is on a case-by-case basis. This depletion of the brain cells that can lead to Alzheimer's. 25% of Canadians over the age of 85 can be affected by Alzheimer's disease. Another risk factor is family history and genetics. There is a small percentage of people who develop Alzheimer's through a genetic disease called familial Alzheimer's disease, or FAD. This is caused by mutation in their genes at some point through time. Having one parent with FAD gene yields a 50% chance of developing Alzheimer's in their elderly age. Mild cognitive impairment, or MCI, is another risk factor. 85% of people aged 40 to 50 years and plus with MCI are at risk of developing Alzheimer's disease. Another risk factor is the APE4 gene. This is the most important risk factor when looking at Alzheimer's disease. The APOE genes help regulate the production of protein that carry cholesterol in the blood. There are 3 variants of this gene. Having an excess of the APOE4 can lead to development of Alzheimer's. Other risk factors may include, but is not limited to, gender, cardiovascular disease, diabetes, and head injury. Now back to the newsroom.
What else can you tell us about Alzheimer's disease, Nathan?
Oh, hello there. I didn't notice you there. Well, Christine and Brittany, the health professionals here at Sunny Valley Retirement Home, have informed me of some different forms of treatment that are being offered for Alzheimer's. Current treatments available can be divided into 3 categories. Pharmaceutical. There are 5 different current medications used. Tacrine, rivastigmine, galantamine, donepezil, and memantine. THC is also shown to be effective in the treatment of Alzheimer's as an acetylcholinesterase inhibitor. THC is the active ingredient in marijuana. Acetylcholinesterase inhibitors reduce the rate of breakdown of acetylcholine, which increases the available acetylcholine in the brain, combating the effects of Alzheimer's. All the above listed medications have been tested to be effective in the early to mid stages of Alzheimer's. Donepezil is approved for the treatment of advanced Alzheimer's. There are also psychosocial treatments available. Traditionally, psychosocial forms of treatment seem to have the best results concerning an individual adjusting to and living with their illness. Much psychosocial therapy focuses around emotion-oriented interventions, which include things like discussing past experiences with the aid of photographs, music, videos, or other items from the past. These show the most benefit in terms of cognition and mood of the patient. Cognition therapy also takes place, which involves cognitive stimulation through presenting pertinent information about the individual with Alzheimer's life. For example, like the date and the place where they're staying, as well as exercising mental abilities. Cognition therapy has been shown to have improvements, as well as elicit frustration due to lack of ability. Caregiving is the most necessary form of treatment. Caregiving involves changes to the living environment of an individual with Alzheimer's, such as labeling food items or household items, and may eventually lead to an individual requiring full-time supervision and care in a home or with a full-time worker at home. Alzheimer's is incurable at this point, and there are no known medicines or practices that reverse or stop its effects. Drugs can help slow the effects, and when combined with emotional therapy and informed caregiving, an individual suffering with Alzheimer's will have a better quality of life. Back to you, Christine.
So this year, more than 103,000 Canadians will develop dementia. This is equivalent to 1 person every 5 minutes. By 2038, this will become 1 person every 2 minutes, or more than 257,000 Canadians per year. If nothing changes, the number of people living with Alzheimer's disease or related dementia is expected to double, reaching 1.1 million Canadians within 25 years.
Right now, dementia costs Canadians $15 billion a year, a figure expected to grow 10 times to $153 billion by 2038. This poses a huge burden on our healthcare system, and we must use this information in order to plan for the future and ensure that we are able to take care of all the Alzheimer's patients.
Well, that's all for today's show.
Thank you for listening.
And have a great weekend.
This is Nathan.
It's Christine.
And Brittany signing off.
Hi, Batman.
Hey, you get that camera out of my face! This is too funny. Oh my god, I'm dying. Look, it sun's walking towards them. You stick there like such a sore thumb. Nathan's like hiding behind a tree. I can still see you, Nathan.